Okay, let's dive into this. It's pretty fascinating to think about the human body as the ultimate machine. I mean, you've got bones, muscles, ligaments, and tendons, all working together in this perfect synchronization. But just like any high-performance machine, it goes through wear and tear, right? Or sometimes a sudden, catastrophic failure. And that is exactly where orthopedic surgeons step in. So today, in this explainer, we're going to explore the incredible world of orthopedic medicine and see exactly how these specialists diagnose, repair, and totally optimize our physical framework.
So, here's our roadmap for this explainer. We've got 4 main stops. First, the foundation. Second, arenas of expertise. Then we'll hit the forge, and finally, we'll wrap up with the reward.
All right, starting with phase 1, the foundation, looking specifically at kinesiology and care. And this brilliantly illustrates how background in kinesiology, which is the study of biomechanics, is literally the ultimate launchpad here. Because honestly, you can't just stitch a torn ligament back together and, hope for the best. To truly restore stability, surgeons actually have to calculate joint mechanics perfectly so their patients can avoid those nasty long-term complications. It's really not just about fixing one isolated injury, it's about completely restoring the body's natural movement pattern. So, you might be wondering what the actual process looks like. Well, a surgeon's job extends way beyond the operating table. It's more of a chronological journey. Step 1 is a precise diagnosis, where they're essentially acting as medical detectives using MRIs and CT scans. Then comes Step 2, which is personalized treatment, and this is never a one-size-fits-all deal. They integrate either surgical or non-surgical approaches to really minimize that recovery time. And finally, Step 3. Post-operative care, because the journey definitely doesn't end when the incision is closed. Surgeons oversee the whole rehabilitation process, working hand-in-hand with physical therapists to make sure true mobility is absolutely fully restored.
And what's really amazing is that top-tier surgeons don't just operate. They are constantly pushing the boundaries of medicine. They're engaged in this continuous innovation. Through rigorous research, they're advancing minimally invasive procedures, developing custom prosthetics that are tailored specifically to a patient's unique anatomy, and even utilizing some mind-blowing robotic-assisted tech to get people back on their feet faster than ever before.
Moving on to phase 2, arenas of expertise, diving into the different subspecialties.
Let's move to and see how this builds into highly specialized practices. I mean, just look at the incredible contrast here. On one hand, you have sports medicine focusing on getting athletes back from things like ACL tears and joint replacement, which literally gives people entirely new hips and knees. But then compare the fast-paced, life-saving chaos of trauma orthopedics with the highly detailed long-term developmental focus you'd find in pediatric orthopedics. Whether it's the intricate precision required in hand surgery or dealing with herniated discs in spine surgery, we're talking about completely different worlds under one massive umbrella.
Okay, phase 3, the forge. Let's talk about the education and training required to get there. We really need to trace this timeline because the commitment is, quite frankly, intense. It kicks off with a massive, science-heavy undergraduate foundation. Think biology, chemistry, physics. Conquer that, and then you face the clinical trials of medical school to earn your MD or DO. But the real crucible, that's the residency. A grueling 5-year gauntlet of intense, hands-on training under immense pressure. And for those wanting to master a specific guild, like we just talked about, that requires even more time in an optional, highly specialized fellowship.
Which brings us to phase 4, the reward, looking at outlook and compensation.
First up, let's talk about career stability. The field is offering a highly stable 3% job growth rate projected right through 2030. Now, while that percentage might sound a bit modest at first glance, the actual demand driving it is incredibly robust. Why? Well, primarily because we have an aging population that's increasingly facing degenerative joint diseases. Combine that major demographic shift with a steady rise in sports-related injuries across basically all age groups, and you've got a field where your expertise is going to be perpetually in demand.
Now, what's really interesting about this slide is how that number reflects the intense training we just talked about. Orthopedic surgery consistently ranks among the absolute highest-paying medical specialties out there. For 2024, the average annual salary is sitting right around $400,428. But remember, that is just an average. Highly complex fields that require that extra fellowship training, stuff like spine surgery and joint replacement, they sit at the absolute top of this compensation scale. Plus, trauma surgeons often see a premium too, just because of the intense, high-pressure emergency settings they operate in.
It's also absolutely crucial to realize how the work environment can shift those earnings. For instance, private practice typically offers lucrative patient volumes and profit sharing.
On the flip side, academic settings might have slightly lower base salaries, but they offer incredible fulfillment if you're heavily focused on vital research and teaching. Oh, and geography? Massive factor here. Rural areas often pay really high premiums simply due to the sheer demand for care, while big metropolitan centers might balance higher salaries with much higher living costs.
But the financial incentives extend way beyond just that base salary. Surgeons often earn substantial bonuses, and what's fantastic is that these are fundamentally tied to excellent performance. They're rewarded for surgical volume, but also for patient outcomes. In private practice, highly successful surgeons might even gain ownership stakes in their actual clinics. So the system is really built to reward those who operate efficiently and, above all, deliver excellent results for their patients.
But hey, let's ground all these high figures in human reality for a second. Because at the end of the day, orthopedic surgeons find immense satisfaction in restoring mobility and truly improving the quality of life for their patients. That right there is the true heart of this career. Whether it's repairing a severe traumatic injury from an accident or helping a kid overcome a developmental challenge like clubfoot, giving someone their independence back, that's what actually sustains these professionals through those grueling hours.
So, we've explored the mechanics, the diverse specialties, the intense educational forge, and the incredible rewards waiting at the very end. It takes a truly unique blend of scientific curiosity, mechanical aptitude, and unwavering dedication to master the human machine. Which brings us to a final thought for the aspiring professionals watching this explainer right now. Which path will you take to heal? Are you going to be the one inventing new robotic surgical techniques, or the one saving lives in the trauma bay? The opportunity for mastery is out there waiting. Thank you so much for learning with me today, and keep exploring.